Okay, members. Substitutes nominated for this meeting, so you're still on the phone.
Sorry, we've received apologies from Councillor Blackburrow and Councillor Dacre, and Councillor Smith, Councillor Audrey Smith is subbing for Councillor Dacre.
Thank you. Members' interest. If you have any disclosable, pecuniary or other interest, declare them either now or at the time. You all know the routine. Admission of the public is not recommended the public be excluded. I would make one comment there. We are on YouTube, and at the last meeting, I sort of forgot that. We wondered the areas that we perhaps shouldn't have done. I just ask members to be mindful of that in future. Thanks very much. Minutes of the meeting, 29th of July. Correct record. Matters arising. I can see Councillor Smith.
Yeah, I've got a matter arising. 86 children looked after. C17, the first point, it says, did figures include asylum seekers? So I think it should read unaccompanied asylum seeking children.
Just have a look. Good spot there. Correct. Need to change that, so anything else, members? Okay, can I have a proposer? Speak, don't wave. Thank you, Sarah. And a second. Thank you. Thank you, Anne. You need to speak, not wave, because my Wi-Fi is shocking. Most of you are frozen most of the time. So tonight's agenda, item 5. Julie.
Good evening, Councillor Raystrick. Good evening, members. We've attended this evening to give you an update on COVID as the first item. There hasn't been any major change in respect to children's social care from the last update that you had from Rob Murray. But Mark Randall is here, Assistant Director for Education and Inclusion, to update you with schools. Clearly, it's a key time with all children expected to be back at the beginning of term, which starts in Calderdale on the 7th of September. Ben Lehman is also here, who's been advising the schools, as you know, about the public health matters. And I would suggest that you take you take Mark and Ben's report together, starting with Mark, please.
Thanks, Julie. Good evening, Councillor Raystrick and members. Hopefully the report that I shared with you a few days ago was comprehensive and has provided a picture of where we currently are in relation to schools opening from the 7th of September, as Julie's just advised. I won't go into any more great detail around transport or around the element of catch-up funding, because I think the detail is already in the document. Schools are finalising arrangements for opening. Obviously, there's been some additional information and additional announcements made last night by the Secretary of State for Education in relation to face masks. So just to make you all aware, that means that all secondary children, year 7 upwards, and staff in Calderdale schools will be required to wear face coverings, whether they be masks or coverings. It's still the term face coverings. And the guidance is for children to wear those within communal areas. So whether that be in corridors, passing each other, not necessarily in classrooms where it's deemed that the other protective measures that are already in place will continue to protect. We're working very closely already with Ben and his team within public health to provide guidance to schools around that new announcement and actually what's expected for them in terms of face coverings. DfE have very much taken the line that young people will already be used to wearing face coverings. They should be wearing them if they're in shops or they're in public indoor spaces anyway, and they will be prepared to be wearing them on transport already before this announcement. So just some additional detail around that. We're just also providing some additional detail to schools around exemption, because we are aware that there may be some young people who will struggle wearing a face mask, face covering. And again, we want schools to be sure of the position they take in terms of supporting children and young people who don't wear their face mask. However, it is important to say that the DfE guidance has also been very clear in saying that just because a child does not wear a face mask will not exclude them from education. So again, that's a very important message and key message that we will be continuing to share with schools. And then really just the final piece of information that I wanted to share with you is just in relation to remote devices. Members will remember that we were able to secure a significant number of devices previously for our children, looked after our children with a social worker, and schools where there were disadvantaged children in year 10. It's really pleasing that the government have now added a second wave to that programme. And now if there's, in the event of any disruption to face-to-face learning in schools, then schools will be able to apply directly for an allocation of devices to support children who, number one, may be shielding or self-isolating, or if the school needs to close down a bubble. And again, it's for those children who have no digital devices, children whose only device is a smartphone, and also children with a single device in the household that's being shared by one or more family members. So schools are planning, they are planning for opening for September, but they're very aware that given the transmission rates, not just in Calderdale, but nationally, then they will, or possibly may need to close bubbles down and move to a blended approach of face-to-face learning and remote learning. So that additional programme and additional announcement from the Department for Education is most welcome to support some of those most vulnerable children who may not yet have a remote device to support learning. So hopefully that's given you a flavour of where we are. As I say, we've still got a week or just over a week left to go, but please be assured heads are really working on their final plans and communicating. In terms of communication, one of our major tasks over the coming days is to communicate with parents the safety and the strategies that schools are putting into place to support children and to welcome them back. And one example being a FaceTime live event tomorrow evening that Debs Harkins, Director of Public Health, is part of, a lead from Locala in terms of school nursing is part of, Leslie Boyer, Senior School Effectiveness, will be part of, and also one of our head teachers from Park Ward is also part of it. So hopefully that will serve to assure parents of the strategies and the protective measures that schools are putting into place in preparation for September. So I'll pause there, Councillor Raystrick, and then answer any questions members may have.
Colin.
Thank you, Chair. Good to hear about the laptop provision, but that's only part of it. What about access to the internet through routers or dongles? Have we made progress there? Because I see from a report later on that those have been somewhat slower in getting through. The other question I had was about face coverings, whether schools would have a stock of face coverings to issue to children who might have forgotten, or the dog has eaten them, or something else that might otherwise disadvantage them.
Yeah, thanks, Councillor Hutchinson. Really good point there. In answer to your latter point, yes, the guidance is very clear that schools should have a stock, because obviously, children, young people may have one, they may have two, but they may get lost, they may get damaged. So schools will have a stock of face masks to be able to provide for those children and young people who need it, if they need it during the school day. So that's a really important thing to mention. So thank you for reminding me about that. In terms of the dongles or the remote devices, my understanding is that schools, if they do wish to apply for remote devices, will also be able to apply for 4G devices, and will be able to link to a BT hotspot, I think it's called. Because as we have discussed previously, then just having the device itself is not necessarily that much use, especially when many schools are using the Oak Academy, which is an online service provided by the Department for Education. So there is an opportunity for schools to apply for 4G dongles if needed as well.
Audrey, before you start, Audrey, as I said, sometimes my screen freezes up. So if you want to ask a question, just log into chat and say, I'd like to ask a question, just like Sarah did, who I'll get to in a minute. Audrey.
Oh, yeah, sorry. I didn't know.
Right.
I thought we were waving.
No worries. But wave
yeah.
at me all you like, Audrey. So I can't see you.
Mark, I wonder if, has the council decided how they're going to deal with fines? I know that they can fine, but does that mean that they will fine parents?
In a very short answer, Councillor Smith, then the answer to that is that we will work with parents. We are very aware that some parents are very anxious about sending children back to school, and they may have been in situations where the children have been shielding, parents have been shielding, children live with elderly grandma, granddad, etc. So I think we will work with schools and parents on individual cases. One of the things the education welfare team are aware of, however, is those parents where children's attendance previously has been poor. So again, every case will be taken into account, but it very much won't just be a one-stop response to fining. There may be parents that are fined because they need to be fined because, you know, historically their children's attendance has not been positive, and they're possibly using COVID and the situation we're in to exaggerate that position. But every case will be treated equally. One of the things we have done is we've changed our paperwork that we send to schools, and we're asking them from a range of questions very similar to those points I've outlined, just to have a full understanding of whether fining is right, or actually whether we need to work differently with that parent and that child in terms of a return back to school. And
will there be an appeals process or not?
There isn't an appeals process for fining anyway, but yeah, I don't envisage we would need to do that, because of the fact that, you know, we will hopefully come to that right decision working with the school and then working with the parent. The process of fining is an interesting one. It's actually us as the local authority who do make that final decision anyway. Schools suggest or recommend parents or families to be fined, but it's very much down to the local authority. So taking into consideration all of those factors, then we're hoping we will be able to arrive at the right decision. However, I'm not saying that we won't be fining any parent, because actually sometimes that parent may need to be fined in terms of promoting positive attendance.
Sarah.
Thank you. So obviously, I know that the advice going forward is that if you know, in the bubbles, if a child is in a bubble, or if a child in a bubble shows symptoms, then the bubble will be sent home. And also there's the potential for, as you've already said, for there to be sort of like a mixture of face-to-face and online learning. I just wanted to ask if, in the case of either bubbles or having to be sent home, or in the case of sort of like if there is a greater lockdown generally, will there still be provision for children with SEND and also for children of key workers? How will that work?
Yeah, thank you, Councillor Courtney. I think it's important to say that any full school closure would be very much a last resort. I think we've got to be very open and honest and pragmatic here, and schools are, and know that actually children do need to be back in school and they need to learn and make up for the lost time that they've been at home. but yeah, we do have to prepare that bubbles may close and it may be a very much of a mixed picture. One of the things we would hope to do as much as possible is that schools would continue to provide for some of those key worker children, and also then those, you know, the children with a social worker and those children with an education, health and care plan. We will be advised very much by Ben and Public Health colleagues and Public Health England colleagues, because there's a slightly different nuance here in terms of contact tracing. You know, we may have children who have been in contact in a bubble with somebody who has had a positive test. So in many ways, their parents would also need to self-isolate. So it's a little bit more nuanced and complicated, but absolutely we would take all of that into consideration, working closely with public health in terms of making the right decision for that child and that bubble, but also making the right decision in terms of preventing wider transmission from that child.
And
Sorry, mine's not a question really, but I do think our officers, our heads and our staff have just worked incredibly hard. I've seen some of the stuff that's gone out from the local authority to schools to try and make sure that they're as prepared as they can be. But I think, well, I just don't know whether everybody shares it, but I am really, really concerned that this is not going to be an easy thing to do. And we shouldn't actually play down how difficult it's going to be to admit those children in a week's time. I mean, we've already got today changes over face masks. We've got the Prime Minister claiming that there was a mutant algorithm that affected the A-level results this time. We've got a top civil servant resigning today from the Education Department. So I'm really, really anxious, because it is going to be so difficult. If you imagine trying to admit 1,800 children into one of our big secondary schools without there being a problem, then we're being a bit naive, really. We've even today heard that apparently the tutoring that was going to be provided, where schools would have control over this £80 per pupil, will only come out term by term. So if you're talking about £80 per pupil for catch-up money, they're going to get £30 in September, October, then another little tranche in January, and a final tranche at Easter. Now, what is that going to pay for in terms of catch-up time? We've also had today early years announcements for reception children, so we have to make sure they don't fall behind. The training is going to be in January. So there's no detail about, well, whether the schools have any control over that. I mean, my background and the people I know would suggest that most early years teachers know how to make sure those young children catch up on their language. They don't need training in January. So I am really, really anxious. And I think our next meeting will be quite an interesting one to see how the entry to school has gone. And I don't think we should pretend it's going to be easy, because it's not, however hard we try.
Sheila.
Yeah, thank you, Anne. I do echo some of the sentiments you've raised there. But my point is mainly about, we talked about children and those who have been shielding, but of course the school is also full of adults who may also have been shielding. And I just wanted to know how confident we are that we're actually going to have enough adults in the school to be able to get all the children in and get them working in the way that's been outlined. And the concern that should some of those adults have to then go into isolation and things like this, are there enough spare adults within the school? And I'm talking teachers, support staff, you know, cleaning, etc., you know, everybody. And I just don't think, like Anne, it's going to be easy. And I think we're going to be facing quite a lot of problems ongoing, really. Thank you.
Care to comment, Mark?
Yeah, thanks, Councillor Aistrick. Thanks, Sheila. That's a really valid point, and it's something that our head teachers have raised in terms of concerns. I asked colleagues in HR earlier this week just around the number of shielding members of staff we've got. I think actually we've got about 50, but they're only members of staff we know about who use our payroll. Obviously, many academies have their own payroll, working patterns anyway. But again, I'm assured that HR are working through with individual schools where there are some cases, because your point is absolutely right. Members of staff who were shielding, possibly extremely critically vulnerable, haven't been in school since March and will be expected to go. So really, Sheila, just to reassure you and members that we are aware of that. Heads are continuing to work with HR, with those staff members in terms of risk assessments and, you know, putting into place protective measures to ensure their safety when we return. I think the thing around it all links together. However, you know, if a member of staff is possibly symptomatic, then that member of staff has possibly had contact with a bubble, so that bubble will close down. So in many ways, it's possibly a little bit like a domino effect, but it's definitely something that we are mindful of, and head teachers in particular are mindful of and continuing to work closely with us to address any issues as they arise.
Colin.
Thanks, Chair. I think Ben's got his hand up. I think there was, but
Well,
I do have a question as well.
We'll do you, then we'll do Ben. We'll just
okay?
let Ben let his mustache grow off him. Are
you okay if I just add to what Mark's just said, Chair?
Yeah, absolutely.
So I think, firstly, and really importantly, the National Shielding Programme has paused. And I think there's recognition that whilst it was the right thing to do at the time, it was a fairly blunt instrument in terms of grouping lots of people with different sorts of vulnerabilities together. The key thing, as Mark says, is that we assess each member of staff who's working in schools and look at their individual vulnerabilities. And the schools have done that. They've worked through risk assessments with each of those members of staff and have made arrangements where they need to protect them. What we have done as a council is ensured that we've got occupational health support there available for all of those staff who were clinically extremely vulnerable. And that's whether schools choose to use our occupational health service or not. We've ensured that we're covering all schools regardless of that, just so that we can ensure that staff are protected as much as possible. So I think it's been fairly robust, and that's not to say that it's not without challenge, but I think the process we've had has been pretty robust, and I think the schools have been very supported around that.
Did I just hear you describe shielding and lockdown as a blunt instrument, Ben? That's very interesting. Colin.
Can I ask about the size of bubbles? Because obviously a bubble is designed so that if somebody becomes infected, then you don't have to close down the whole school. But we're becoming increasingly aware that at secondary school age, there's probably a greater likelihood of infection taking place than in primary school. And I heard this morning that at secondary school level, the bubble is going to be the year group, whereas at primary school, it's going to be the form. So I just wondered whether the size of that year group would mean that would be a high chance that quite a lot of kids would have to be sent home at any one time. I'm just asking whether that is correct and whether, you know, what's determining the actual size of the bubbles that are being put in place.
Thanks, Councillor Hutchinson. You're absolutely right. The guidance could be that in a secondary school, the whole year group could be a bubble, whereas in a primary school, it's highly likely it will just be the class. And again, the notion of bubbles is that if there is a case, that bubble can be closed down very quickly in relation to the contact tracing element. Secondary schools, again, it varies from school to school. It's really around curriculum entitlement and it's around making sure that children can stay together, but they can still have their full entitlement, you know, and can move around different parts of school closely together. I would imagine if there was a case within a bubble, whatever that bubble might look like in terms of size, however, then through talking to Ben and colleagues, then actually that decision will be made by the head teacher about whether, in terms of the contact tracing element, then the whole year group did need to be closed down. It might be, that might be worst case scenario, but it could be that it might not be. We don't necessarily know the answer to that, but the bubbles and the size of bubbles is very much around ensuring that all children can have their full entitlement to all of the national curriculum subjects, or the GCSE subjects in year 10 and 11. And obviously, I think it's also important to mention that bubbles, face coverings, they're only two of a range of protective measures that are being put into place. You know, hand washing should be far more regular. The respiratory hygiene should be very much high priority. Also, additional cleaning should be high priority. So there's a whole wealth of measures that are being put into place in schools, and the bubble element of it, the face coverings, is part of it. And the bubble, again, is an additional part of it, albeit an important part.
Although, of course, the children come in from their homes and outside environments. And so, you know, the larger the, all I'm saying is that the larger the bubble, the greater the chance that at some point it's going to be burst and closed down.
Yeah, absolutely. Absolutely. But even hopefully the idea is, even if it's a year group bubble in a secondary school, then it's one year group that will need to self-isolate, whereas the other year groups in that school will continue in terms of learning. But I do think, as Councillor Collins and Sheila and Councillor Raystrick have mentioned, it will be an interesting few days and weeks and months when schools do return, because we will, you know, head teachers will work with us and continue to work with us, but actually will take that robust and swift action to protect all of their children and members of staff.
Helen.
Thank you, Chair. Apologies for joining late. I have a few technical problems. A comment and a question, really. Might be the only person who's actually gone back into a teaching role this week, as I'm in college, and some interesting sort of observations. Loads of good things in place in terms of one-way systems, social distancing, mask wearing, so on, but it's only going to be as good as how well it's enforced. And a lot of it's very counterintuitive in a role of teaching where your instinct is to go up and assist somebody, to go the extra mile, try and help somebody, rather than to actually recall, no, we've got to say 2 meters distance. And my head of department was sort of readily there, pretty well with the big stick saying, stay 2 meters apart and so on. So I can easily imagine how easily this could slip. And my understanding was in Scotland, where there was infection, it was staff to staff rather than from children. So I think that's one thing we've got to be aware of. I think the other thing is, don't want to be the pessimist, but preparing for a worst case scenario. And there is another partial, a whole scale closure. Would we be equipped to be able to deliver the curriculum online or virtually? I know we've had extra laptops, had the question about dongles, but we couldn't have anticipated, okay, what happened in March. But to me, if there is a second wave, we ought to be, as much as we can, able to deliver the curriculum remotely, so as few people as possible lost out.
Thanks, Councillor Ruffron, really good point. My answer is that yes, head teachers, as part of their planning, have been thinking about it in two parts. First of all, let's plan, let's look at risk assessments, let's look at arrangements to welcome children back, but actually let's have a plan B, and let's look at our curriculum planning, let's look at our curriculum progression model to make sure actually that if we do need to close a bubble or the whole school closes, then that learning can continue. From a local authority perspective, our school effectiveness officers have already been working with primary head teachers in particular and subject leaders, albeit, you know, through the Calderdale secondary cluster works being ongoing, and that will continue to ensure that actually, you know, that the subject leaders have a real understanding of the curriculum, how it's planned, how it's sequenced, and where those gaps may be, and also to ensure equality of opportunity, where we may have some children who are at home, but some children who are in school, for example, in the same year group, and actually how that equality of opportunity can continue to ensure that learning continues at the same pace and linked more effectively to the same elements of the curriculum. So it's going to be a challenge, but it's something that head teachers, with the support and guidance of colleagues in school effectiveness, will be able to tackle with earnest.
All right, thank you, Mark. Who's next, Julie? Hello.
Okay, Councillor Oastrick.
Who's next?
It's the one adoption report.
All right, I thought you were going to put Ben in the hot seat.
I wanted Ben to join with Mark because of the public health issues, particularly in relation to schools. But if there is anything else that members would like to ask Ben, just generally in relation to young people and COVID, now would be the time.
All right, we'll move on. Item 6, one adoption, West Yorkshire.
Hi, yeah, I'm Michelle Rawlings from One Adoption West Yorkshire. So I'm just going to summarise the report that was submitted to the panel. We were asked.
Sorry, is it just you coming?
No, Sarah's here, head of One Adoption as well.
Hello, Councillor. Yes, Sarah Jo Hall here, head of One Adoption West Yorkshire. I came last year in August, so I'm here with Michelle today.
All right. Well, let's just remind ourselves while we're here to consider. We asked you to come back from last year. We enjoyed the report last year. Specifically in relation to retention and recruitment, in order to progress the recruitment of adopters and placements for children and young people. That's the first 6 pages of your report. Fascinating report, by the way. So if you'd like to kick off, we should go through that initially.
Yeah, absolutely. So as you say, we were asked to come back and provide more information around the recruitment and retention of adopters within West Yorkshire on behalf of the 5 West Yorkshire local authorities. At the time we came to panel last year, we'd only been in existence for a couple of years, and so we were in the process of collating more data to be able to kind of evidence our recruitment and retention. So another year down the line, we've now got more data to be able to see what the patterns are. So in the last year, the 1920 year, we recruited 113 adoptive families. So that's a year-on-year increase in terms of our adopter approvals. Of those 113, 10% were from Black and minority ethnic backgrounds, and I know that was something that panel were interested in last year. We're aware of the need to improve our percentage of Black and minority ethnic carers to make sure that we've got a full range of adoptive families to meet the needs of children requiring placements, but also not relying on that as the only factor when we consider matching children. Within that cohort, we had 16 households who were able to consider sibling groups and 34 households who were open to early permanence. We continue to see a good number of people coming forward that are interested in providing early permanence. Fewer families that are open to considering siblings, and one of our plans in relation to addressing that is to provide additional training for people, which is going to be co-delivered with experienced sibling adopters, which will launch next month in a hope that more people will be open to considering siblings. 16 of the households we approved were open to children aged 4 years and over, and 2 were able to consider a child with a disability. We've seen throughout the year, we've seen an increase in all areas in terms of the number of people in the process, which is really positive, and that has continued in the start of this year in terms of throughout the COVID period and the lockdown period. We've seen a huge increase of inquiries, and at the 30th of July we had 153 requests for home visits compared to 113 in the same period in the last year, which was an increase of 40 requests. at the beginning of this financial year. And we had 57 formal applications to begin the adoption process. And we approved 42 households in the first 4 months of this year, which is an increase of 5 households in the same period last year, which, considering the circumstances we're working in and that we've moved to virtual adoption panels, is really positive. We were asked to look more at the diversity of the adopters that we have, and we know that we have around 1 in 5 of our adopters identifies as LGBTQ+, and we know that nationally around 1 in 7 adoptions is by such a family. So for us, that's really positive in terms of the numbers of adopters coming forward. As I've said, we know we need to do more around engaging the BME community. Currently we have 18% of children in West Yorkshire with a placement order not matched with adopters who are BME, and the percentage of adopters is fewer than that. There's also a mismatch between those adopters in that we have a higher number of applications from Pakistani and Indian families within the region, and fewer from Black African and Black Caribbean families, and we have more children of Black African and Black Caribbean heritage waiting to be placed for adoption. So as much as we don't look to match ethnicity, it is a factor in adoption, and we need to be confident that any adopters who are looking at transracial adoptions can meet the needs of the children. So we're working with My Adoption Family and our local voluntary adoption alliance to look at how we can work more effectively to recruit adopters from those communities. We've just had a really interesting meeting this afternoon with some Black African and Black Caribbean adopters and people from within the community to explore some of the barriers to people coming forward to adopt, and what we can do to overcome some of those. We were asked to provide more information about our conversion rates. So for the people that have made a formal application to adopt, we've seen from 2017-18, 77% became approved. The year after it was 72%. We are still waiting for some of the people who made their application in 1920 to become approved adopters. So as the year goes on, we'll have more information about those conversion rates. That's a summary of the report.
That's brilliant, thank you. Before we start, I have one question.
Okay.
Well, actually 2 or 3, but I'll start with the easy ones. You said 1 in 5 adopters were LGBTQ+, and yet of the potential of the 113 households you approved, only 3% identified as LGBTQ+. Is that a mismatch, or is that a typo, or is that?
Yeah,
it is. Figures marry up?
Yeah, it's an error in that figure in terms of the number. Yes, it is. The percentages lower down in the report are the accurate figures.
What is the accurate figure?
So in terms of the from the 1st of April to 31st of July, it was 18%. Yeah.
I've got it. Thank you very much. That sorts that out. Audrey. Audrey.
Thanks. I just wondered, what were some of the reasons that the Black and African Caribbean adopters gave? What were the reasons that they gave for communities not wanting to adopt?
So some of the reasons they gave were trust in statutory agencies and having confidence in what might happen to the information they provide, and where that information might go and what views of them might be formed if they provide that information. There was a feeling that the process is intrusive, which it is, but I think for people in the Black African and Black Caribbean community, they were really concerned about providing such a deep level of information about themselves. Some people referred to negative experiences that they heard from other people, but also not hearing the positive experiences. I think because there are fewer adopters from that community, word of mouth is key, and there isn't necessarily that word of mouth within the community to be able to hear the stories, the positive experiences that people have had. So those were some of the barriers. We also talked a little bit about sort of finance and having enough space, and sort of some of the other things that are potential issues for all people coming forward to adopt, but not necessarily being confident that would then be overcome in working with the local authorities. And so it was a really interesting and useful conversation, and gave us an awful lot to think about in the messaging we give, and some of the myths that are still out there about adopting. You know, one person referenced age as a barrier to adopting, which is absolutely not the case, but we've still clearly got a huge amount to do in terms of addressing some of those myths around adoption.
I think if I may just add as well, just adding from what Michelle was talking about in response to that question, I've been doing quite a lot of work with the National Recruitment Campaign, and we've been engaging with Black African and Black Caribbean communities, and some of the research that we've undertaken really underpins some of the issues around dealing with authority and public kind of government, kind of local government arrangements, particularly given kind of Windrush, given kind of COVID-19, and also the kind of socioeconomic poverty issues that often people from Black and minority ethnic communities find themselves in. So those were some of the really big barriers. And we do have a very big kind of national campaign that's happening in the autumn. It'll be in October, moving into National Adoption Week, specifically around Black African, Black Caribbean communities. Some work being piloted in Birmingham and London about a slightly different approach, but in West Yorkshire, Michelle's been leading the way with My Adoption Family and the Voluntary Alliance, looking at more innovative and creative ways at kind of engaging those communities.
Thanks.
Colin.
Thank you. I know that lots of different and flexible ways of working have had to be put in place over the last few months, and I don't underestimate the challenge. But I was alarmed that it seemed that an inability to get medical assessments done was producing a major barrier at a time when really time is, you know, keeping time down to a minimum is essential, I would guess. And I just wondered what reception you'd been getting from your work with either the clinical commissioning groups or the West Yorkshire Healthcare Partnership to try and actually make clear that this is an essential piece of work that does need to actually take place now, notwithstanding the risks of coronavirus, and where you thought the barriers lay.
Yeah, we've had a really positive response from the CCGs in terms of asking for these appointments to be prioritised, and sort of reiterating the importance of the appointments. I think we're seeing a real variation in terms of responses from individual GP practices, and we have some who are offering those appointments. We have some that are working with us with the adjusted forms and doing some of the work virtually and using patient records so that we can move things forward and not have delay. But we still do have some surgeries who are refusing to offer appointments or undertake the medicals, and we are escalating those where we come across them, but it is causing delay in some cases. It's improved over the last couple of months. I would say we've definitely started to see progress, but there are still some where we're finding that a challenge.
And you're finding that you have access to the routes of escalation where this is a blockage, and okay.
Yeah, I think we've
we
done
are.
quite a lot of work on that actually, Councillor Hutchinson, about making sure that we can escalate things. And as Michelle says, we've been successful in some of those. But I think this is a national issue as well. And I know that the Department of Education have been talking to the Department of Health about looking at GPs prioritising this area of work. So I know that they're having some calls around that on the national level as well.
Okay, well, I would hope that if you feel that we can do anything as a local authority, that you would escalate it through us as well.
Absolutely, thank you.
Yeah, I'd echo that sentiment. Sarah.
Thank you, Councillor Eastrick. Yeah, so you were talking, it's interesting talking about the barriers of getting adopters from different ethnic backgrounds. What's the makeup of the staff at One Adoption in terms of ethnicity? Yeah, that's my first question.
Okay, so yeah, we are aware that we need to increase the diversity within our workforce, and those are conversations that we've been having. We do have a predominantly white female workforce, and we've been having conversations about what we can do to improve the diversity, because we are aware that for people who inquire from the BME community to have a worker go out and have those conversations with them who has a similar ethnicity to their own will be of benefit, and it will help to build those relationships.
I think the Black Lives Matter agenda, we've really had some very interesting discussions with staff about kind of the retention, the recruitment of staff. And we have 2 Black managers, and we have a number of Asian, Pakistani, Muslim and also Indian staff, but very few African, Caribbean and African staff. So that's certainly something that we're really looking to try and encourage people to come into this area. And I guess we look particularly to our social work colleagues and about the social work recruitment to universities in the area. So we've been doing a bit of work around trying to make sure that we can get placements from a diverse range of students coming into One Adoption, and think about how we try to build that workforce up. But it's a very pertinent point, Councillor Courtney, for us to address.
Okay, thank you. And then my other question is about sort of drop off and when people, obviously, I mean, it's great that your recruitment is increasing. That's fantastic. And there is sort of like a small amount of drop off, and I think it was around sort of 70-ish% go through, isn't it? But my understanding is that for people who make initial inquiries, the drop off is quite large. Now, obviously, there's a lot of people who are going to make inquiries about it and then just go, oh yeah, it was really different to what I thought. But do you have any information about or sort of facts about, or do you keep data about why what reasons people give for sort of dropping out or whatever, being rejected? I don't know, but specifically for sort of dropping out, I suppose.
Yes, so in the very early stages where people come along to an information event, that's a public meeting, and we don't ask for any details or information about from people at that stage. But once people enter the process and make a formal application, we do collate the reasons for them leaving the process, whether that's a decision by us or whether it's them choosing to withdraw. I did some analysis early in the year of whether there were any themes and patterns arising from that. And it was quite diverse in terms of the reasons people leave the process, but we did see some things that we could learn around the messaging that we give at the very early stages, around the timing being right. So we found that some people had changes coming up in their lives, house moves, job moves, and so the timing wasn't quite right for them to progress. And we recognised that we needed to do more in terms of our information sharing about adoption, so that people understood that wasn't necessarily the right time to move forward with adopting. We had some inquirers who were smokers, and again that led us to strengthen the message we give around smoking and the guidance around that in terms of prospective adopters. But there were no significant sort of consistent themes coming through from that analysis. In terms of people withdrawing from the process in stage 2 after they've gone through that initial stage, again, there were varied reasons for that. Pregnancy was one reason. Another was changes in employment or financial circumstances that led to adopters deciding to withdraw until they're in a more stable position. We had some people who actually, having learned more about the needs of the children and the therapeutic parenting needed for adopted children, they felt that actually this wasn't the right way for them to move forward, and it was the information that led them to decide it wasn't right for them. So lots of different reasons that people withdrew, and again, no themes emerging from that led to us to be concerned about any areas of practice or anything that we needed to address.
It sounds very positive. It sounds like you are listening, and any bits like any changes of messages that you can make, you are going to make. So that's, I suppose that's the main thing, is just to analyse the information, to pick up on any themes that you can then work with. So okay, thank you. Thanks for those answers.
Amanda.
Thank you, Chair. Hello, Michelle. Hello, Sarah.
Hi.
Hello.
Hiya. So, yeah, I'm really grateful to be able to ask these questions. Obviously, one of the things that we look at is the right kind of adopter, and I think, like as you've said, we need to make sure for the child we've got people who are culturally aligned and people from the right background. Can you just clarify exactly what is meant by the right kind? Because it's quite a subjective statement, really, isn't it? I know it's a guidance that you have to follow, but just so that we can be clear, we've got 1,172 responses coming from your marketing, that then goes down to 722 households who have attended a information evening, down to 153, I think you said, requests for home visits. Is that the ROI, the registration of interest?
It's not, no, the request for a visit comes before the registration of interest.
Right,
it's the initial discussion with people that takes place before the application.
Okay, so it's still it's coming down quite high, quite early, isn't it? So is it something to do with finding the right kind of people that we need to recruit?
I think it's really interesting when people think about adoption and they come to our information event. As Michelle said, it's a public meeting and people can find out about it. And sometimes people have a kind of an idealistic view of what adoption might be. And I think the information event tries to give people an understanding that adoption has changed over the last 30, 40 years in England, and actually we don't have many relinquished infants to place for adoption, and that children that we need to find families for have often experienced very early trauma or development issues or neglect, and so actually we need adopters who can provide therapeutic parenting really for those children in order to help them recover and develop and lead to their kind of potential. So I think we're looking for those sorts of qualities, and I think we're quite explicit about that at the information event. And naturally speaking, a lot of people drop out. So if you look at, say, for example, in fostering, we know that the conversion rate from inquiring to approval ranges around between 9 to 12%, because the drop off is pretty massive at that first stage. And often, I read prospective adopters report where people have come a couple of times to information events, sometimes 18 months ago, but then they've decided to go maybe down an IVF route and then they come back again. So we do expect to see a very high drop-off rate, if you like, from that information event. I think the crucial thing is, once you've got an application, from application to approval, what's the dropout rate and what are the reasons why people are dropping out? And I think, after we came to Scrutiny Board last year, as Michelle said, we did a lot of analysis about why people have withdrawn. And I think the themes that we've learned from that have been very helpful for our staff to think about how do we provide a more consistent message to people, and how do we give people, if you like, the tools and resources to help them to think about what therapeutic parenting might be like and things that they might need to consider. And if you like, qualities in themselves, openness, acceptance, being able to be curious, empathy for the child, for the birth family. So lots and lots of different things. So I think when you're talking about right kind, then it's all of those kind of things that we're trying to get people to think about in helping the children.
Thank you.
Follow up, Amanda?
For now, yeah, thank you.
Okay. I have just a point and then a question, which is not on recruitment, I don't think. I'm trying to get my head around this 1 in 5 and 1 in 7 are LGBTQ. Why are we spending a lot more time contacting that community? It's like a rich seam, if you like. I guess the percentage of people are LGBTQ, I don't know what it is in the country, maybe it's 10%, and yet 25% of them are adopters. Why aren't we contacting that community as well as the BAME community? It seems to me it's a much richer seam. I'll leave you to ponder that. While I want to talk about interagency adoptions. I'm not really quite sure I understand what they are. I suppose there's a parallel between fostering and interagency adoptions. Why do we choose to use outside agencies? Can't we recruit enough of our own? Is that the reason? Or private fostering arrangements? What specifically is a private fostering arrangement? I don't understand how that works. If you could, and you say that they went up last year and then they've gone down this year, I want to understand a bit more of a rationale around that. Was that too rambling?
Do you want to try that, Michelle?
Yeah, go on. I had an answer for the LGBT one.
Give me that first.
Give me that first. So we are very much engaging with that community. We spent last summer attending all the Pride events across West Yorkshire and raising the profile of one adoption. Obviously this year those events have been cancelled, and so we've had to focus much more on doing online engagement with the community. But I think what we know is we do engage well with the LGBTQ plus community within West Yorkshire, and so we already have existing relationships within that community. What we know with the BME community is we need to work harder and focus more efforts into improving our relationships there and our reputation there. So I guess that's the reason. It's not that we're not focusing on that that area of the community. We absolutely are, and yeah, we were at every event we could be at last year. So in terms of the interagency question, it is about sufficiency. It is about the number of adopters that we can recruit within the area and how that compares with the number of children that are coming through with a plan of adoption within West Yorkshire. And there are fewer adopters than there are children. So we need to explore the adopters that are approved primarily with our local voluntary adoption agencies, because we work wherever possible to keep children nearby, close to where they come from. But for some children, we do have to look nationally at the voluntary agencies and the approved adopters that they have in order to find matches. And that allows us to find matches for some children that without that resource, we wouldn't be able to place them for adoption and we wouldn't achieve adoption for them. So
it's important to note as well, just adding on from what Michelle was saying, that voluntary adoption agencies are non-for-profit, unlike the fostering sector where, you know, some of those are for-profit. So we work with Barnardo's, Adoption Matters, Adopters for Adoption, SAFA and the Yorkshire Adoption Agency. There's 5 key agencies, and in actual fact we've now got a contract with the Alliance. They're working together to provide 30 families for children that we need to find families for. So the idea, as Michelle says, is really to broaden out that kind of sufficiency. I think that the difficulty is that if you like, the time it takes from us to get an adopter from an information event to approval takes a period of time, and actually we need to have a good range of adopters because our numbers of children are so vast actually compared to other areas. We just don't have that resource within our internal provision to be able to meet that demand. and of course, you can say have 100 children and 100 adopters, but they never quite match. So you have to have a bigger pool of adopters to be able to give you the choice to get the right family for that particular child. I don't know whether that answers your questions, Councillor Raystrick.
Yeah, sort of. I'll have another question now. Disruptions. I see the 7 last year. Is that a normal number? What's the national average? Are we performing better or worse than anybody else? We should have those numbers. There's loads of local adoption agencies around the place. Is 7 acceptable out of, I guess, 100, 110? And what do we do when we do get a disruption?
So ideally, you'd want no disruptions, and that's what we are working to achieve. I would say before we became regional adoption agencies, then there was generally kind of 1 each agency. So 7 is roughly around what we would have had if we'd have put all the numbers from across West Yorkshire together. We've been doing quite a lot of work on what happens when there is a disruption, not just within West Yorkshire, but also in partnership with the other agencies across the wider Yorkshire and Humber region, so that we can develop some standardised practice around disruptions to make sure that we are following an agreed format in terms of scrutinising what happened, and take the learning away from the disruptions around what could have been done differently, but also how we can move forward successfully in achieving adoption for those children if that is still the right plan for them. So there's been a lot of work done, and we've just recently drafted the processes around around the disruptions for moving forward.
I think also, just to add, that a number of those disruptions have happened where children have been placed at a distance. And actually, one of the things we're really trying to, if you like, develop and improve on is our relationships with adoption support agencies in the area where the children moved to. What we found was that we were making requests of the local agencies to support, but actually those resources weren't necessarily available in that area, which is why I guess that also was another reason for us to go into a contract with local agencies so that we can provide more support locally, because we know what that support's like. So that was a learning for us in terms of making sure that we get a really good adoption support plan for those families and children where they're placed at a distance.
One second, Amanda. Are we good at helping out other authorities when they ask for our adoption support?
Yes, I think you know, we've done quite a lot of work in West Yorkshire to make sure that the offer is available to any adoptive family living in the region, whether they're approved by us, whether they've got children from us or from other authorities. So whenever a child is placed into our area, the local authorities are notified that a child has come into our area, and there is a responsibility on that agency to approach the local area to find out what adoption support services are. So I'm aware that, you know, our adoption support teams are supporting a number of families where children have come from other areas. So yeah, I think there's more to be done between regional adoption agencies moving forward about getting a protocol together between the regional agencies about this sort of thing. And, you know, we've been talking about that recently as a group of regional agency leaders, just to look at how we can collaborate more to improve that service to families moving across areas.
You can't ask other people to look after ours if we're not looking after theirs, can you? I'd like to see a few numbers around that at some stage. Amanda.
Thank you, Chair. I've got quite a lot of connection with other prospective adopters, as you can imagine. I made lots of friends in the 2.5 years I was in the process. And I understand, you know, there's lots of factors that we've got to consider to whether people can progress or not progress. Can you tell me if BMI is one of those factors? And if so, what is the cutoff level? Because obviously, you know, with the level of obesity we have in our society, I'm wondering if that's an inhibiting factor that people can't actually apply because of their BMI. Thanks.
Okay, thank you. So there is no cut off as such in terms of a BMI. Obviously, we want adopters who are healthy and well and can promote a healthy lifestyle for a child, and also are physically well and able to meet the needs of an energetic young child. But all our adopters, as part of the process, undergo a medical, and we use that medical information. That medical information from the GP goes to our agency medical advisors, and we take on board their advice, and where there are health concerns as a result of BMI, then we would be having conversations with prospective adopters about that, and talking to them about ways that they could perhaps reduce that in order to sort of address some of the concerns.
Okay, do you think that BMI sort of inhibits the prospective adopter in some way from being a loving parent, or how does it connect? Explain to us how it connects.
It's not about kind of the quality, the love. It's not related to that. It's about being able to provide a child with a healthy, active lifestyle. And it's if there are concerns that actually there are significant health implications that might mean that adoptive parent isn't around into that child's adulthood. And our children come from a background of trauma and significant amounts of loss. And so wherever possible, we want to be placing them with adoptive families who we are confident are going to be able to parent them into adulthood in a safe, secure, stable home. There's so much more to it than just that health, but we have to take it into consideration given the experiences that our children have had.
Yeah, I totally agree with you. You know, it's just, obviously it just limits the number of people who can apply, and if we're looking to increase the number of people who are applying, and you know that we're approving, then it's definitely a factor, isn't it, with the level of obesity that we have in our society. All right, thank you.
Anything further, members? I've only just recovered the fact that as a smoker, I'm not allowed to adopt a child. So. Although I'm reasonably healthy, honestly.
If you want a child over the age of 5, then that's something that can be considered.
While we're on BMI, this is probably going up on people's heads, but BMI is a pretty inexact science, because I remember that Lawrence Delalio, who was the best number 7 England rugby player of all time, had a BMI of 39 or something, been a class of clinically obese. Yeah, I was running around the bloody World Cup final, won a World Cup final. Anyway, so let's not go there. I thought this report was comprehensive, very interesting, and quite reassuring. It's only been 3 years. Who would have thought? Numbers are going up. That's what we like to see. I don't think we had any difficulty with any of their questions. I'd love to see you again next year.
Lovely. Okay. Thank you, Councillor Aistrick.
Thank you very much. Item 7, members. I've lost item 7 here.
Thanks, Councillor Aistrick. I just ask Kat or Lisa Spencer are here from the Pathway Service, which is our commission service for leaving care. I'll just get them to put their videos on, and I'll let them introduce themselves, who's our commissioning manager. So I'll just let them get themselves sorted out. Thank them for waiting. I know you had some problems getting in, Jill. So thanks very much for attending this evening. I'll just everybody on. I think Michelle's still there. Michelle, you that's it. Michelle's gone. That's great. Thank you. Councillor Aistrick, you asked for this report to come because it was taken as an annual report to corporate parenting, and you asked for it to come to Children's Scrutiny. And you have got the same report, but it has been amended with some more up-to-date data. So I'm going to hand over to both Jill and to the service, the Pathway Service, to do the introductions for you, and then to open it out to questions from members.
Thank you. No pictures yet.
I can see everyone, but I'm not sure everyone can see me.
Yeah, I can see everybody too.
I'm still waiting for Jill. Is Jill on video?
Jill's there, yeah. Yeah,
Must be
Lisa
just,
and Kat
be
are
just
there.
my Wi-Fi.
Do you want to introduce yourself so people can put a face to your names, and then we'll get into the report? Thank you.
Shall I start, Jill? Is that okay? I don't know if Jill can hear me. Can everyone else hear me?
Yes,
Well, I can hear you, and since I'm the important one, so that'd be fine.
Good to know. So good evening, Chair, and good evening, members, and thank you very much for inviting us to come along and present today. Much appreciated. I must give the apologies from the service manager, who is the author of the report, Susan Holden. She's actually on leave, but you have myself. I'm the operations director for Prospects Shaw Trust, who oversee pathways in Calderdale, and we have Lisa, who is the deputy service manager, with us. Lisa, I don't know if you want to introduce yourself.
Yep, hi, my name's Lisa Spencer. I'm the deputy service manager at Pathways.
I won't. Sorry, Chair.
Welcome. I don't think you've been to Scrutiny before. Let me tell you how this is going to work. We've all read the report. Give us the highlights. Ow, yeah. A very sore shoulder. 5-10 minutes. Tell us what you're doing, where you're going, what your outcomes are, and then we'll have a chat.
Okay, thank you very much, Chair. That's really helpful. This report is up to March 2020 on the previous 12 months. And as Julie has rightly said, we are a provider of services to care leavers. As you've rightly said, you've had the report, and I'm sure you've gone through it in some detail, so I won't go through it line by line, but I'll just go through and highlight some of the issues, and then we can take any questions that you might have, and hopefully we might even have the answers, fingers crossed. So in terms of the report, you've had a bit of a service summary there around the staff team structure and what we actually do. We have a team of social workers and pathway advisors, workers working with young people between the ages of 15.5 and 18, and the pathway advisors, the over 18s. Legally, we provide a service for care leavers between the ages of 18 and 25. The age range was extended in recent years from 21 to 25. But it's important to note that 21 to 25-year-olds can tell us they don't want a service, but if they can do so at 21, but they can also come back at 23 and say help. So that service is always available to them. One of the most important documents that we create with young people, and I'm very clear to say with young people, is the pathway plan, which enables them to look at, accommodation, budgeting, health, education, training, employment, and social inclusion as well. And that's one of our really, really important documents that we complete with young people 6 monthly. In the last 12 months, there have been some changes within Pathways, and one of the most important and most positive has been that we have got a new service manager and a new deputy service manager, both of whom bring a great deal of experience and knowledge around the care leaving services and requirements for care leavers. So that's been very positive. What hasn't been quite so positive is, and bless them, they both arrived earlier this year in February and March, just before lockdown. So they were just getting into the swing of understanding the service, the staff, making really positive relationships with partners when a little bit of a halt came to that, and they had to turn their attentions to ensuring that Pathways was able to meet the needs of the vulnerable young people during an unprecedented lockdown situation. And they've been very, very good and done a great deal around that. You will see on page 6, we have got some up-to-date information in regards to young people entitled to a service and young people actively taking up support. In March 2020, there were 292 young people entitled to a service and 236 actively taking up support. The gap there is in relation to those 21 to 25-year-olds who are unable, who may choose not to take up support. So those are the figures we're currently dealing with. You'll see there's been an upward trend since 2019. That's very much in line with a national trend of increasing numbers of children looked after. And obviously, with the increasing number of children looked after, as the conveyor belt goes forward, you have more young people who are entitled to a service as care leavers. The overall increase in numbers means obviously that caseloads are quite high within the service currently, particularly for the pathway advisors. We would normally have a maximum expected numbers of about 30. We are pushing and exceeding that. And one of the things that I would say in regard to that is those are active caseloads receiving a support. The virtual caseload, which you will have seen documented further on in the report, those are young people 21 to 25 who aren't actively receiving a support at the time, but can phone up and say, I'm really struggling, these are the issues for me in my life at the moment, please can you help? And we would obviously support them, and that would be in addition to the caseloads. One of the things that we've been very, very keen on is ensuring that we receive regular feedback from young people receiving services. And we have something called a feedback focus each quarter. And as you will see, there is documented within the report some key information around what young people are saying. Overwhelmingly positive feedback. Young people saying that their relationship with their advisor or their social worker is very positive. On top of that, saying that they know that they're cared about, that their feelings are taken into account, and that they're listened to. And that's really positive to get that feedback. You will see that obviously in March, we had to very quickly change some of our delivery to account for lockdown. And we had got some young people who hadn't got sort of bank accounts, that kind of thing, because they preferred cash. And we managed to very quickly sort out services so that they had mobile phones, bank accounts, laptops, etc. As we're emerging from lockdown, we are meeting, we've obviously delivered a service throughout lockdown, but we're now meeting the needs and coming out of the restrictions, taking into account government guidelines and safety measures, but we are doing more and more face-to-face work with young people now. One of the really interesting things that we did as an organisation, Prospect Shore Trust, including Calderdale young people, was we did a questionnaire type survey with young people around what they were receiving during the restrictions, during the lockdown, what they found helpful, what they would like more information, about, what they would like to change, but also what they would like to see in the future. I found the responses really interesting. We had over 300 responses from young people, and they very clearly said that what they required and what they found most valuable was face-to-face. And I think sometimes that can be seen very differently from myself, certainly as an older person who has repeatedly been told that young people like virtual contact, via apps, telephone, all that kind of thing. Actually, the responses that we got back was their preferred method face-to-face, telephone coming second, and then all the apps and the, FaceTime kind of virtual contact came last. But I think it was very useful to get that information, because that allowed us to take that into account when we started to come back to a more normal way of working and a new normal, shall we say. Generally, going through, we have a lot of quality assurance processes to make sure that we are doing reflective supervision, that we are feeding back to workers around some of the information that we're gaining through those supervisions, but also through audits, which we feed into the Calderdale system. And, you know, just ensuring that there's a deep understanding of individuals' needs. So regular supervision takes place where there are in-depth reflective discussions around cases, so that we can be sure that those young people's needs are being met, that we're reflecting on how that happens, etc. Just moving forward, we are developing our partnership working between lots of other agencies, and Susan and Lisa have been very proactive about that, but really embedding the partnership between ourselves and Calderdale, working with the MI team to ensure that we're being able to pull off data rather than actually have to go through it manually. So working with the team around updating tasks so that certain parts of the system are working well with those older agents, etc. So that's really, really positive. You will see that there is some really good information in the report around education, and it's really pleasing to know that Calderdale is consistently high in terms of being in education, training and employment. That's a positive set of data. There's information there around participation, accommodation suitability. So again, looking at young people that are in what is deemed to be suitable accommodation. Calderdale are doing well in that regard. Moving forward into keeping in touch, you will see the data there. 94% of the cohort of 125 have been in contact with the service between January and March, and 84% have been in contact in the 6 weeks prior to the end of March. The statutory expectation is contact will take place every 8 weeks as a minimum, but it, you know, in the report it is detailed. It's important to note that some young people are seen much more frequently than that. Some that are in a crisis situation, for example, will be, you know, more than once a week. So there's a movable feast depending on the needs of that young person. There's some information there in terms of characteristics of the young people being supported by the service, and some information around unaccompanied asylum seeking children and where they're placed. During lockdown, we explored the needs for extra support for that group, but concluded that there was a lot of support for that group already in place. And whilst we would continue to check that things were going well, we didn't need to provide additional support. You will see that there's some information in there around young people who have mental health issues. It was really interesting actually listening to the previous discussions around mental health issues, etc. Some of which might have been, you know, exacerbated by COVID. What we have found is that the majority of those issues that are coming to our notice are low levels of anxiety and depression on the whole. Where there are other issues, obviously, we bring in experts and we advice and guidance and refer young people on. I have to say, one of the really positive things that young people feed back to us is around their can't speak this evening, their ability to have a free leisure pass, which is very widely used by the cohort of young people that we work with. And also we have been working very hard to ensure that all of our young people are registered with a GP and a dentist, and currently we're pleased to report that 100% of those known to us are. you will see that there are elements detailed in the report of where we have worked with young people to improve the service. One of the important ones being they've worked with us to adapt the pathway plan to make it better for them and easier for them to engage in. So that's been very positive. I won't go through too much because I'm aware of the time that we're going through, but again, lots of information in there in regards to caseloads and those that are allocated to the virtual worker and the partnership working that we have been completing. I've already mentioned some of the quality assurance activities, so I won't go into that into any more detail. You may wish to ask some questions on that. I have to say the health support and the nominated health service worker that was put in place last year has been very positive and has continued to be positive even with the lockdown. So that's been very, very good. And you'll see that there's a little bit of information there in terms of future planning for pathways moving into the current 12 months. So I'm hoping that had enough information, but we're happy to take questions, either myself, Lisa or Jill.
Thank you very much. Sarah.
Thank you, Chair. I've got a couple of questions. So my first question is, we've talked about the young people that you're supporting. It sounds like supporting very well. So it sounds like really good work. Do they all come from Calderdale? Are they all from the care system in Calderdale? We were talking in our previous discussion with One Adoption. You know, it's sort of like clear that there's some fluidity in geographical fluidity. Oh, is that a term? Yeah, so I just want to know, you know, if a young person was to move into Calderdale from another area, even if they hadn't been sort of like in the care system in Calderdale, but they've been in the care system elsewhere, would you sort of support them? That's my first question. My second question is, you know, the report seems really positive, and you're sounding sort of confident, and which is great. And you were talking about, you know, how you reflection and quality assurance and stuff. How do you feel you're doing as a service in comparison to other services in other areas? Do you feel like you're doing well? The figures look good, but how, you know, are you looking at sort of like reflections on that sort of wider level? And then my third question is in section 5, when you're looking at the characteristics. The characteristics of our young people. You've got age, you've got ethnicity and gender, but you haven't got sexuality. So is there support for how are you making sure that any LGBTQ plus young people, of which obviously there will be amongst those numbers, that they're making sure that they're getting supported, and any other characteristics that any other sort of like groups that may need extra support? I mean, I don't know, you know, in terms of sort of like, you know, do you have children who are part of the deaf community, those sorts of things? So just making sure that everyone is as fully supported as possible. Those are my 3 questions.
Okay, thank you. Lisa, can I spread these questions out a little bit? So the first question in regards to young people from other areas.
Yeah, so we're only really funded to work with children from Calderdale, so children that are coming through the Calderdale care system. However, if there are young people who are placed in Calderdale, then we will be informed of that. So, for example, I attend a top 10 missing meeting every Thursday where we discuss young people who are known to the police or different services who are going missing. So if those young people are in our area, even though as a local authority we're not responsible for them, their social workers or leaving care workers would be from a different local authority, we would still discuss them in the context of safeguarding generally they'll probably be known to some of our young people as well. So we would look at that as a whole, and we would link with other leaving care services, as we do. You know, if we have a young person that moves out of area, even though we're responsible for them, we may link to that leaving care service to source relevant accommodation, particularly as they get into when they're over 18. So we might, if we have a young person who wants to live in Manchester, then we would link with, say, Manchester Leaving Care Service. We would look at what's available there, take advice from those services that know their areas very well, and we would do the same. We would support any other leaving care service who contacted us to let us know their young person was in the area, and could we maybe signpost and advise for any help or support. And also just in case there was maybe an emergency situation, you know, we do have, you know, I think quite good reciprocal agreements that with other local other leaving care services, should a young person, you know, be in crisis and need some help immediately. And we would obviously, you know, hope that they would do the same if it was one of our young people in a different area.
So I think your second question, Sarah, was around reflection, quality assurance, how we're doing compared to other areas. Is that right? So Pathways is very much part of the Leaving Care benchmarking forum. So that's where lots of services from other areas get together and, learn from each other, etc. So we do that kind of work. My role is a national one. So I oversee services in a variety of different areas. And that's very positive because that does allow us to, pick things up from other areas and look at how that we can use that to our advantage in Pathways, etc. In terms of some of the data that you have, I would say Calderdale is doing incredibly well. It's this group of young people are often very hard to get into education, training and employment, for example, because they've had disruption in their education. They've got emotional issues due to family crisis, etc. And to look at the figures that you've got in Calderdale compared to others, I think is very positive. And the national figures are there as well, and you can see that we're exceeding those. So I think there's a lot of positives to be said. We're not perfect. We have got an improvement plan because I think people can always improve, and we can always improve. And there are areas that we want to do so with. So we're not perfect by any means, but I think if you look at us as a national comparator, we are better in some areas and equal in most of the other areas.
Are those figures available? Yeah.
Say again, I'm sorry.
Are those figures available?
The figures in regards to national data?
Yeah.
Yes, they are. They're generally published on, that you can access them openly. They're published on an annual basis. So yes, we can get those for you if you would like.
Please. Amanda.
Oh, hang on. And my third question was about the LGBTQ.
Oh,
yes.
I'm sorry, Sarah.
That's all right.
My apologies. I forgot that one. Again, Lisa perhaps has more to say, but I think one of the things that I would say is that the relationship between the support worker, whether that's the social worker or the pathway advisor, is one of the most important ways that we provide support, and that support is provided on a very individual needs basis. Everybody's assessed and their needs are dealt with. If there is a need, for example, for a worker to have more in-depth knowledge around something to provide appropriate support, then we would provide that training or bring in something else. But I will hand over to Lisa because Lisa may have other.
Yeah. And I would say that the pathway plan, part of the pathway planning is looking at a young person's identity and a young person's needs holistically. The plan will cover all aspects of their you know, of their world, you know, and what's important to them. Of course, some young people may choose not to disclose their sexuality, and of course that is entirely up to them. But where a young person does disclose that, whether they're part of the LGBTQ community or, like say, part of the deaf community, then what our workers would always do is look to source all the relevant support groups that are available in the area. And as we say, if we have young people out of area, then we would source that in the area where they live. And then what we would do is ensure that that young person's got access to that information. So if they want support to link with a certain particular group, link to whatever that characteristic is, then we would actively support them to do that. I think some of our young people have been involved in local pride events, and I mean, I'm very new to Calderdale as well. I'm not just new to the service, I'm actually new to West Yorkshire. Yeah, I think for me, I'm still exploring some of the groups that are available for our young people, but the staff do seem to have a really wide range of knowledge, and yeah, can link young people. And of course, a lot's being done online at the moment, so we get quite a lot of information through at the moment about different support groups, different opportunities that are coming through online. So again, you know, it's really important that we feed out that information to our young people and how they can access support in this kind of new normal.
Thank you. That's great.
Audrey.
Thank you. Me next, Chair.
Sorry, Amanda.
That's all right. It's okay. It's okay.
Yeah.
Thanks for the really interesting report, Kat. It's yeah, it's great to see some fantastic work being done in this area. And welcome, Lisa, to West Yorkshire.
Thank you.
You've got a lot of beautiful places to discover. It's
yeah. They've actually relocated here, so it's absolutely wonderful.
Yeah, welcome. Okay, so I guess my bag is mental health, and many of your young people will have experienced adverse childhood experiences. And you mentioned that when they do, then you'll pass them on to some sort of therapeutic intervention. Now, the most obvious experience they might be having is an attachment disorder, for example. So what type of therapeutic intervention is on offer for these types of, like, well, in particular, attachment disorders? Thanks.
Yeah, so Calderdale have their children's therapy service, which all our care leavers have access to up to the age of 18. And actually, I have to say the service is really good, and where we have a particular young person who has a certain need, often that service will continue to work with them for longer than that. So again, through the assessments that are being completed by social workers in terms of single assessments and care plans, which then as young people come to our service turn into the pathway plan, exploring mental health is it's an ongoing, really, it's an ongoing, it's just a part of every day that we do. You know, lots of our young people have varying degrees of mental health, which can present as low level anxiety, like you say, straight through to attachment disorders. And, you know, often, you know, our young people have come from have had some very traumatic experiences. So we would look, you know, with our under 18s, you know, who are still kind of looked after, you know, children looked after. You know, we do work with our placement resource team to look at therapeutic placements if that's needed, so that support is in place. You know, we have had young people who've been in hospital, so part of that discharge planning is to work again to find the right therapeutic placement. So it's really a lot of multi-agency work that takes place between CTS, between health services, you know, CCG, pathways, sourcing the right placement, sourcing the right support, and then putting that in place for those young people. And again, these are individually tailored plans.
It's great to hear that there's funding there for them. I'm just, you know, I think it is obviously quite a new thing, really, that therapy is in place, but it's just fantastic to see that care's actually wrap around now, rather than it just being all over the place. Thank you. That's really helpful. Thank you, Chair.
Okay.
Thank you. Yeah, first of all, I'd like to just say my questions are around the unaccompanied asylum-seeking children. And I'd just like to say that I've had feedback that the service has improved greatly since Lisa and Susan took over. However, there are a few things that I would like to just ask about. There's a comment I don't fully understand around money, that there isn't sufficient rent for for the unaccompanied asylum seekers, when they get leave to remain, they move on to universal credit, and they said that the housing benefit doesn't cover the cost of the stay in campus house. I'm not sure. I don't understand why don't they get additional support naturally, you know, from being in the situation that they are.
So my understanding with Campus House is obviously we've done quite a bit of work with Campus House since we came in post as well, because I know there were some concerns around Campus House. We've worked very closely with Migration Yorkshire. I know Susan has actually been out and visited Campus House and worked with the new management team. But I think the fundamental issue is that the single rate of housing benefit wouldn't completely cover the rent at Campus House. But for some of the young people that have, you know, that are residing in Campus House, it's their stability, it's been their security and their stability, and at this moment in time they don't want to move on from there yet. They're in college in Bradford, so their links with Campus House have been very strong. So what was happening was the local authority, so the young people could claim housing benefit to the single, you know, to the maximum amount that they can, and then the local authority was making up that difference in the shortfall in rent. However, from kind of the work that Susan has done with Campus House are now reviewing those rent payments, so that actually the housing benefit, so as the young people now are signing new contracts, it will be the reduced rate of rent that the housing benefit will cover. So that's secure accommodation for those young people if they want to stay there, and if they're ready to move on, then we will support them then to source sustainable, affordable accommodation wherever they want to go.
If I could just come in there as well to say that I don't think this is an issue that's just being experienced in Calderdale. It is generally something that is a bit of an issue around the country, where young people who have been care leavers are coming out, and actually the accommodation that they can afford with the credit system that is in place currently doesn't match up often. So I don't think it is just an issue for Calderdale, if that helps.
Yeah, sorry, I have got a couple of questions. I think there is a slight worry about language and communication, and making sure that the people are transitioning, getting the best out of the transition work. How are you managing to deal with that? And I also wondered, what are the numbers in Campus House? And we talk a lot about personalisation, but I don't think, to the best of my knowledge, there aren't any white British people in Campus House from Calderdale, and I am worried that they are being lumped together, and maybe Campus House is not the right place for a lot of these people who have been traumatized. And are you looking to sort of find other placements in Calderdale?
Yeah, so just to answer that, I think we've currently got 12 young people in Campus House at the moment. I think for Susan and I, when we came in post, it was really important to us to kind of work with Migration Yorkshire and get some feedback from them around young people's experience, and to get some of that feedback from young people. And some of the feedback we got really was that we didn't feel that, you know, there was a feeling that interpreters weren't being used enough. So we have done quite a bit of work with the staff team about ensuring that interpreters are used, because, you know, a young person's, you know, spoken English might be okay, but actually their real level of understanding at this critical time, you know, might not be what it presents to be. So we, for all of our interactions with young people, we are using interpreters. If we, you know, we can book interpreters in advance. We work with Campus House, let people know. We also have a support worker who has now got office space back at Campus House, who's available to all the young people that live there. That is a bilingual worker who can also support them with, you know, doing some orientation for young people when they move to Campus House, supporting them. If young people need some support, they may receive a letter or such thing. But that worker can also alert their worker, their pathways worker or their social worker, that this young person actually needs an appointment, and we can book that with an interpreter. We have sanctioned for the staff that if anything happens in an emergency, then they can use language line. So if they need to make a phone call that's quite critical and needs to be done quite quickly, then we can use language line to make sure that we that young person has got access to all the information and support that they need in their first language. So we try and prevent any kind of misunderstandings. Sorry, what was the other part of your question?
Just about the best place for asylum seeking young people, because you know you talk a lot about the personalization and making sure that the people get the right placements, and I know that you know a lot of them are in this place in Bradford, and I know I totally appreciate that there aren't enough placements in Calderdale, but I just worry that some of them probably do need more support than others.
Yeah, I would agree with that. I think some young people, you know, some young people do need more support than others, and we try to obviously put in place whatever young people need. I'm not always entirely sure it's always been Pathways' decision about where young people are placed, but we certainly work with young people, you know, about what they want, and then would work from that point.
Can I come in here, please, Chair?
Sure.
And I have mentioned this before, and this is through personal experience of meeting young people who've just newly arrived into Calderdale. There is an element of personal choice here. And at one of the Pathways Christmas meals, I met a young person who'd arrived that day. This is a couple of years ago. It was in the town hall. Who was basically, I want to be in the city. I want to be in the city. I want to be in college. I want to be near a mosque. I want to be with other people from my own community. I want to be placed there, and was asking quite clearly to go to Leeds or Bradford, knew before they even arrived in Calderdale where they wanted to be and who they wanted to live with, and you know the kind of amenities and facilities. So you know I think we've got to we've also got to respect some of that as well. You know, young people come over and are very ambitious for themselves and for their future, and have their own views as well about where they do want to live. And I know that I think you did a visit there, didn't you, Councillor Smith? Did you go and look round?
I've been over. I thought it was quite. I thought it was an awful place, but the car showroom, office sort of space for having one-to-ones with the support worker, I didn't think that was very suitable. I don't know, it's changed. And also we've had long discussions about this, and things have moved on. And I know from talking to Refugee Council that things have improved for a lot of people. So it isn't in any way saying that we're not trying to do the best, but I'm just wondering what the policy is, because it does feel that there is a blanket policy of people going there. And I think you're right, some people are very happy there, but I do think we need to be careful that the people that aren't are just as considered, I suppose.
Yeah, thank you.
Could I come in there? Is that okay to reiterate a little bit? Just to confirm what Julie was saying, actually, was last year we did go through a process where we spoke to everybody in the particular property we're talking about, to ask them to move, and we were actively looking for alternatives for them, and they were very clear that they didn't want to move, and were very very vocal in saying that actually that they were happy there for a number of the reasons that Julie had already highlighted there. And just to go back to one of your earlier questions, we did a specific audit around unaccompanied asylum seeking children, because we were aware of some of the issues, and we wanted to look into that in more depth. And one of the positives that came out of that was in relation to the use of interpreters, as Lisa said earlier, but it's not just anecdotal. We actually did do some specific auditing to double check on that.
Thank you, Audrey. Colin.
Thank you, Chair. I was really interested to hear the feedback from the young people that you're working with about the preference for face-to-face contact rather than online, because we're so often being told that digital first is the way that things have to go, but it's a lot more nuanced than that. And there are a lot of people who in certain circumstances really need that face-to-face contact. But even so, with the coronavirus around, digital contact is important. you say that you've recently managed to get laptops for young people in pathways, but you're still waiting for routers to gain internet access. How long have you been looking for those, and do they have to come from a central repository, or are they ones that can be got reasonably easily?
I'll hand over to Lisa in a moment, but just to say that where we've identified young people who are desperate, they can't continue their education, for example, without one, we have purchased one. So we haven't, let someone whose life is being negatively, hugely affected by that continue. But Lisa, in regards to the wider provision of dongles.
Yeah, I mean, I'll be honest, I've not led on this part, so Susan would probably have had a bit more information than me on this. So I know that we've had the laptop. I think we've had roughly around 40 laptops that have been delivered, which we're distributing out to our young people. For a lot of young people, they probably will have internet access either at home or wherever they're living. Well, as I say, if we find, I'm assuming that the routers are going to come through a central point. In the interim, what we have done, as we say, if we've had any young people that are struggling with their access, then we have provided a dongle for them to enable them to, particularly through the lockdown, so that they had access to the internet. They could do their online schoolwork, college work. So yeah, so we're just continuing to progress that at the moment.
Okay, because I mean, it is 5 months since the lockdown was instituted, and it does seem that this element of things is taking an awful long time. And I was just wondering if there was anything we can do at this end to speed it up.
I'm not sure, to be quite honest.
Right. Okay. The other.
Sorry, Helen.
The other point was you said that the free leisure pass was very much appreciated and widely used. I wondered whether we supported people with access to public transport, which can be a major limiting factor in people making best use of what there is for employment and for education, as well as social use. Do we support public transport access?
Can I just come in, please, on the 4G access before I answer the question around the transport? Just to let you know, Councillor Hutchinson, it is a national government issue with the Department for Education. We've received all the laptops for pathway children and for looked after children, but we're still waiting on the 4G connectivity through the routers for them. It is something that we're following up with the DFE all the time, and the DFE have really said to schools they've got to be geared up for remote learning by the end of September, so that you've got that safety net there if there are infections, transmission in the bubbles, and children are sent home. So I'm hoping we receive it before then, but it did take quite a few months for the laptops to come, but we've got those, we've distributed those, and we're just waiting on the 4G connectivity. But we do keep that on the agenda with the DFE all the time.
Right, I just wondered if PC World could help out.
I know.
I can confirm I'm talking to you today from Gloucestershire, and we've got exactly the same problem. Laptops are there and the connection isn't yet.
Helen.
I probably would just like to echo that point as well, that if we are going to be positioned to deliver all learning remotely, which I think we must be, we've obviously had months now to get ready for the fact that we could be in this position again. And obviously we've got to be in the situation we can. So just to redouble our efforts, and I would tend to say, go down to PC World and buy them and bill somebody if we don't get them provided. The other thing was also on the education issue. We have some very good successes with education. Obviously we can always do better, but it's good to say, compared to the national picture, we're doing very well, and we have got some young people in higher education, which is great to see. And I'm just wondering perhaps how far we can, as well as congratulate these young people themselves, can we use these examples as role models for young people coming through the care system in terms of raising aspirations, making people aware of what is possible, and if people did want to be involved in any mentoring. that's my question. And I wonder, Chair, you might have said this at the beginning, but I wonder if I could just hang on that. Our congratulations to young people who did their exams this year, because I know we got some very good results from our looked after young people. So I think but just wanted to hang that as well. But perhaps if you could just answer the question around role models and mentoring in terms of raising aspirations, please.
So one of the things that we're working on at the moment is engaging young people in lots of ways, to social media, etc., to do exactly that. Things that we did more widely was work with young people to get the message about staying safe on COVID, from COVID, so that young people were sending messages to other young people. So as an organisation, we'd like to develop that more fully. One of the interesting things, if you look at the Calderdale figures, is a number of your relevant young people that are care leavers go on to higher education much later. And they're not counted in the national figures because they're over the age of 21. But that's really important, because what that says is that people aren't giving up in their young people once they're past the normal age of going to university. For example, it's being recognised that the young people in the pathway service often do have ACEs, childhood experiences, which impact on their ability to smoothly move through, getting their A levels, moving on to university, but actually go back to things at a later stage. And the pathway advisors are very good at keeping those aspirations so that even if they aren't in higher education at the earlier age, they go back to it later. There has been this year a little bit of a downward turn in terms of some young people are choosing to do different types of further education rather than just go to university. And any evidence about why that is purely anecdotal, but there has been a push, for example, for more apprenticeships, that kind. And that may be one of the reasons why that's the case at the moment. But yes, absolutely, I think that's a really good idea, and it is something that we would like to explore.
Yeah, I mean, just to add to that as well, I believe that obviously not being in post so long, but I believe that last year there was quite a an event for all of the young people in the service, including those young people, kind of a celebration event for all those young people that had graduated and done well in their exams. So kind of having that, as you say, that aspirational event there for other young people. We have had 2 of our care leavers who have completed apprenticeships with us. We've got one of our workers who's actually leaving us at the end of the week to go to university. And we are looking at another young person coming to join the service who's an absolute IT whiz kid who hopefully is going to revolutionise our social media. So we are trying to actively encourage wherever we can internships and apprenticeships to bring young people who've used the service actually through to working within the service, and then having, being that inspiration for other young people. We have talked with Virtual School about kind of planning some kind of celebration event, but it's just been a little bit limited this year because of COVID. So those discussions are still going on about potentially doing something later on in the year where we could potentially bring back some of our young people who've graduated university this year and done well in their exams and have some kind of event. But at this moment in time, we're still kind of very cautious, really, because of the whole COVID situation.
Could just perhaps very quickly come back on that. And I think the point you made about people going into higher education, as mature students, that in a sense makes the mentoring and the role model more important, because if you don't actually do that well at first time or probably the exams, it is something you can still go back to and realize the rewards of perhaps going to higher education as a mature student. So I think it's really great to hear those success stories and things we'd love to hear as a panel as well.
Yeah,
thank you.
We are linking with the council just at the moment around the apprenticeship for one of our young women who graduated university this summer. So we're hoping to progress that forward.
Right, thank you.
Very good. I've long been a supporter of the Calderdale family, working for the Calderdale family firm. I'd like to ask just a couple of questions now. Around what you were saying about quality assurance, Kat, this panel is very familiar with the audit process in our social care. It's one of the drivers of our improvement over the years. And around that audit process comes a whole set of data. How many audits you do, how many were good, how many were outstanding, how many were poor. And then the lessons learned from that, as I say, have driven the improvement. I've read, I see that you conducted a dip sample. I wonder what the outcomes of that were. Then it says you made improvements based on that, but what evidence have we got to say that? Do you keep account of the audits? Do you check them? Are they done monthly? Are they done 6 weekly? Is everybody getting supervision? When we get reports from our social care, we have all that data to hand. And that's what I'd like to see really around that. We can say it, but I want to see that we've done it and the lessons that have been learned.
Yeah. So in terms of the social work process around self-audits, etc., we mirror the Calderdale system, and we report into the SMOP meetings with the composite audit reports. What we hadn't got previously was a tool to do a self-audit on the pathway advisors, so the 18 to 25 year old, the work that's being done with those. So in the last, over the COVID period, actually, that's been devised and put in place so that we can now do the same type of process for pathway advisors, 18 to 25-year-old cases, as well as the social work cases as well. So we do use the same service. And I've just seen a little message from Julie, and I'm ever so grateful because I always forget what SMOP stands for. So thank
you. So what you're telling me is that that data is there somewhere?
It should be, yes.
Okay, I think I'd like to see it.
Yeah.
The other thing is that while we're on data, I read the report, and when it came to corporate parenting as well, I think the word manually is used 4 times or maybe 5 times in this report. I'm absolutely astonished that we're still using manual data. Where we were at the 10 years ago, we were converted to CAS, the system for our social work, and absolutely everything's on that. We just print it off at the blink of an eye. People going through filing cabinets, that's prehistoric, surely.
So that's where the positive work's really been done by Lisa and Susan. They've been working really closely with the CAS system to address some of the shortfalls in terms of, again, it was more the, you know, obviously that there was very clear data around the children looked after, but it was the older age range which the CAS system hadn't quite been configured to pull it off in the same way as it could for the younger age range. But a lot of that is either now been sorted out, so it's working much better, and so in the future the reports will be much more easily drawn as you describe, or they are in the system of being replaced or changed to make that system a little bit easier. There were just some blips in the system for the older age range that we hadn't addressed previously. Lisa, I don't know if you want to add to that.
Yeah, I just think it's, I think there has been some, there's some information that CAS pulls through, and it pulls it through the pathway planning. And I think that what we've come to realise when we've really reviewed the data that goes into CAS through the pathway plans is there was quite key fields that hadn't been built in. So I think what previous managers possibly had done is set up spreadsheets to kind of capture that, where and I have to say it's credit to Susan really. You know, Susan's I think worked quite closely with Jill and the management information team in the local authority to actually look at what fields do we need, and they've been prioritising putting those fields in, so then workers can input the right information, so then the management information reports can be run from CAS quite easily in the future. So I think there's still a bit of work in progress going on in some areas, but I think, you know, there's been some quite positive changes that have taken place, and hopefully the dreaded spreadsheet will be a thing of the past.
Yeah, I'd just like to talk about caseloads. I think our social worker teams run on 23. You talk about your social work teams running on 20 and your pathway advisors on 30. And you've not adopted systemic practice. I wonder why that was. I see you've got a plan to mostly closely align service systemic practice working with that of the local authority. I've got a plan to be a millionaire, but that just involves lottery tickets. So I was wondering what your plan was and when you expect this plan to take place, and when, and if you think that'll increase your capacity.
We have a different model to the pod model that sits within Calderdale Council. Obviously, as a procured service, we have different restrictions, and obviously we need to bring in within budget, etc. So we don't have the system that sits within the Calderdale CLAR teams, for example, where there is an administrator per pod, etc., etc. So there are differences in how we operate in terms of on a daily basis, which does impact on caseloads and how many individual young people can be supported. So that's one area. In terms of the systemic practice, I'm not sure. To be honest, I can't answer that question, and I think probably that would be one that perhaps Susan would need to respond to.
Okay, Anne.
Well, mine's just a really quick comment, because Colin and myself were actually on the corporate parenting panel meeting that took the annual report before. And I think the things that Colin's just raised were the kind of issues that made us want it to come to scrutiny, because you're beginning to answer those questions, but we've not got the answers yet, have we? And I think that's why it would be very useful to come back when you've got a bit further with trying to gather all this data together and make sure that these systems match each other where they possibly can. Because that's what caused us concern at the corporate parenting panel. There seemed to be a mismatch, a lack of data, and it's obviously been picked up now. But I think we need to know that you're actually confident that you can carry that on in future.
So we do monthly reporting to, quarterly reporting, I beg your pardon, to commissioners and provide data, etc. to them. And we're working really closely to ensure that just what you've just explained, that data is easier to give to them, and that it can be interrogated more easily, etc., etc. I don't know if Jill has anything to say.
If I can come in there.
Sure.
So just to say, we mentioned earlier on that an improvement plan had been put in place, and that was through discussion with the commissioners following quarterly monitoring meetings. We identified that we needed to strengthen the leadership of pathways. And the deputy manager post that Lisa now occupies was actually an addition to the establishment early this year, by way of trying to strengthen the team. Some of the discussions about data, you're absolutely right that we wouldn't want to be in a position whereby we have to manually extract data in today's day and age. But we have identified through new management and systems that we'd got some gaps in post-18 data that we were able to extract through the data reporting system. That is actively being addressed, as Kat's identified. Some fixes have already been put in place, and we are confident that we will be able to run all of the reports from the case management system for all children and young people in the Pathways service going forward.
That's reassuring. As I say, when this committee gets report, just the audit thing again, we would know in and out how many we've done, what were good, what were bad, how we were good, what lessons had been learned. It's really important to drive improvement. I'll just go one more point. We're going about on page bottom of 13. We're talking about feedback and how overwhelmingly positive it is. Those are your exact words. 613. In response to a survey, partners indicated that they and the young people they supported were not always clear about the workings of the Pathway service. That seems to me to be quite a major problem.
So when I said about overwhelmingly positive feedback, that was in regard to the young people's feedback to us. In terms of that, that was addressed really quickly, and we now have a finalised document that goes out to young people to introduce Pathways, what it does, who we are, all of that kind of thing. I think it was an addendum to the report. It may not have been, in which case I apologise, but there is a finalised letter document that goes out to all young people to really clearly welcome them into the service, but also to give them absolute clear information about what the service does. So that was picked up very quickly. That was the document was compiled with young people, so it was done in partnership with them, and it's now in use. So that goes out now.
All right, thank you. Anything else, members? If not, I'm pretty sure my dinner's ready. I'd like to thank you all for coming. I would like to see that addendum, by the way. I'm sure the board will love to. And I'm pretty sure we'll be seeing you again. Maybe we'll make a regular thing about it.
Yeah.
All right, thank you, members.
Thank you very much.
Meeting ain't over yet, though, members. But the guests can go.
Okay, thank you.
Thank you.
Thank you.
Pleasure.
Do you want me to stay, or do you want to go through the work programme on your own?
No, yeah, I'm happy for you to stay, Julie. We're not going to say anything nasty about you, honestly. Work programme.
I'm worried about. It's not me I'm worried about.
You were missing out, and you're the one that misses out. They're the one to talk about. That's why you never miss a meeting. Right, so Lauren, talk me through it. Or do we just want to? We know what's coming, don't we?
We do. We've got an education focus meeting for the September one, so that's underway with planning. Obviously, I've circulated the work programme, and it's yours. So if there's any additions or amendments, I'm more than happy to take those and make them as we go.
So any suggestions, members? Okay, then there were none. So we're looking forward to the education one. I'm particularly looking forward to C&K careers. I think that'll be lovely. And we'll see how we go when the school's open.
Colin, can I ask that we bring the one adoption back again to look at I suppose the conversion rate and what the actual people who drop out, why they drop out. I'm still feeling as if
we get them every year anyway. I think we'll probably have them in another year as well. So they came last August, they come this August.
Well, it'll give me 12 months to get more evidence from other prospective adopters, I guess. I think it's important that we get the prospective adopters' voice as well as the children. A lot of people have said to me that they feel silenced because of the process. So I'm just putting that out there.
Yeah, that's fine. We can have them in next year. I'm pretty sure we're going to be seeing Pathways again.
It will come as an annual report, the adoption report. I think given your conversation and clearly a number of you are at corporate parenting, it would be good to have a report sooner. Not wait for the next annual report, but maybe in a couple of months.
No, I don't think so.
Running to bring it back.
I think around the improvement plan, if there is an improvement plan, Julie, I think we'd like to see it.
Okay.
I think whenever it's been finalised, and well, I think there's nobody here now that doesn't need to be. I think it's just it was very difficult to make sense of the report. We're used to more data.
Yeah.
You know, and the lack of access to it is really a bit scary. Members, it's dinner time.
Thank you, Chair. Thank you, members.